I'm Brandy Cruz, and this is Undivided. Undivided is brought to you by 1530 Mortgage. Visit them at 1530mortgage.com. Today, as West Coast states struggle to get homelessness under control, politicians are willfully ignoring a key component of the crisis.
We need to build more housing.
Plus, few cities in America have dominated the headlines like Seattle. Outgoing Mayor Jenny Durkan reflects on her legacy after a challenging few years.
We can't ignore the fact that the pandemic disrupted everything in the city and in our country.
And finally, a Washington state restaurant pays the price for violating COVID-19 mandates. The owner on why she believes she's on the right side of history.
When the governor did what he did in March, I said, no. Anytime there's fear put in the people, that's not the way government should operate.
I'm Brandy Cruz. Thanks for joining us on Undivided. Washington Governor Jay Inslee is outlining a plan that he's calling
the biggest and boldest comprehensive collaborative approach to solve our homelessness crisis to date.
The governor acknowledging something that has been painfully obvious for years.
We need to step up our approach big time.
And rightfully, he says it's a crisis that can't be solved by a single city or county, something that has become crystal clear.
This is a statewide problem, not just Seattle, not just King County, and it calls for a statewide solution.
But the solution doesn't matter one bit if you haven't properly identified the problem. And the governor, like many politicians, continues to beat around the bush.
We know that there are many factors to homelessness, not just one, to this homelessness crisis. Starting with the lack of affordable housing. We need to build more housing up and down the scale in the state of Washington.
To the governor, this is primarily an issue brought on by a lack of affordable housing, as if someone goes from failing to pay rent in their Belltown apartment to shooting up heroin on the corner of 3rd and Pine. Anyone who walks 3 blocks in Seattle knows what the true problem is. We have a homeless crisis because we have a mental health crisis and a drug crisis, and no amount of affordable housing will fix that. Now, as the governor rightly points out, there are a variety of reasons that someone might wind up on the streets.
We have unemployment, we have poverty, we have behavioral health needs of people, we have substance abuse needs of people. We need to deal with domestic violence, and we need to provide accessible options for people with disabilities. I mention this because I think at times we get into arguments about the cause of homelessness. There are multiple things we need to do to solve these problems, and that's why we are proposing to do multiple things up and down the problem. And we know that COVID-19 has only made this crisis worse.
But poverty, the pandemic, people who are fleeing from domestic violence, those aren't the things that pushed this to crisis levels, and we know that. And that's why the governor's $800 million proposal is so baffling. In it, only $46.8 million is specifically designated for supportive behavioral health services, a tiny fraction of all spending. In fact, in a 1,600-word essay the governor's office wrote about his plan, they only mentioned substance abuse one time. And instead of being, ashamed that we have to spend another $800 million on this crisis because things have gotten so bad, the governor actually bragged about all the other money we've spent on this under his leadership, money that the taxpayers have yet to see the fruits of.
It is not the only investment we have made. In the last several years, we've gone from $65 million to $400 million investments since I've been governor.
I'm not sure who told the governor it was a good idea to brag about spending more and more money on a crisis that's gotten worse and worse, but what do I know? So let's recap all of this for a moment. All of a sudden, the governor wants to take bold action to step up our approach to a crisis that's gotten worse and worse under his leadership over the past 9 years. While I wish him the best, forgive me if I'm not overflowing with confidence. The governor wants us to believe that he's going to tackle a crisis that is complicated by severe mental health issues, despite the fact that our state's mental health system has deteriorated under his watch, so much so that the state's largest psychiatric hospital lost its federal certification. Again, forgive me if I'm not overflowing with confidence. The governor points to King County Executive Dow Constantine as a leader on this issue, someone who has been in office for 12 years pushing ideas like closing the county's largest jail, all the while a crisis that's fueled by addiction that leads to crime has proliferated on the streets of his county.
I want to thank Dow for your leadership. You've been a real leader on this.
Forgive me if I'm not overflowing with confidence. The governor wants us to believe that he has a solution to a problem that he either can't or won't properly identify. It doesn't matter whether the state spends $800 million or $800 billion. Money is not and will never be a replacement for good ideas and good leadership. Now, don't get me wrong, I don't want the governor or any other politician to fail. What I want is for voters to stop letting them. There are few cities in the country that have been in the headlines over the past few years as much as Seattle, and not always in the headlines for the right reasons. Seattle Mayor Jenny Durkan is entering her final few weeks in office, and as her time at City Hall comes to a close, she and I sat down to talk about her legacy and some of the most profound challenges that she's faced while in office. And I started the interview by asking the mayor one simple question. Is Seattle better off today than it was when you took office?
Absolutely. I think that, and it's not just my leadership, it's working together with the people in the city across industries, collaborations with business, with King County, with the state. I think the city's much better off.
You think there's probably some places where it's not better off?
Better off from what it could have been or better off from where we are, because we can't ignore the fact that the pandemic disrupted everything in this city and in our country. And there was life, before COVID, BC, and then life during COVID. And unfortunately, we're still in that life. And so having to respond to a crisis of that proportion eclipses everything else. And I'm really proud that I and the city were able to move forward on critical programs, even during the pandemic, that really enhanced our opportunity as a city to recover and recover well.
When I look at, though, issues like homelessness, street crime, police staffing, those have all gotten worse. Could we agree? I
think that we've got incredible challenges there. And there's no question that both the pandemic and the events of the disagreements between myself and the council added to that. But I also think if you look at some of the fundamental things we've done, even in this last year, we've made progress on those. We've stood up a regional homeless authority, first in our region, that really can be the framework for making progress there. Working with Chief Diaz, we are going to do everything we can to increase the number of officers, and I've talked to incoming Mayor-elect Harrell. It's his priority. We know we need more police officers. We've stood up alternatives to policing that can work with police officers and take some of the things like crisis intervention off their plate. And on homelessness, by the end of the year, because we pushed on getting more shelter, we'll clear the largest encampments, Broadview, Thompson, Ballard Commons, Chinatown International District, and hopefully Green Lake. So we are really trying to make progress so that the city can start a fresh start in January.
On the pandemic, this sounds like a cold way to ask this question, but do you feel like your term was robbed in a way by the pandemic, that you couldn't do all the things and focus on all the things you wanted to do because of that crisis?
I would frame it differently. I think history calls people to do things, and at this moment in history, we had to have leaders that would stand up to lead and really focus on the science and challenge across the board both the health impacts and the economic impacts. And we've seen it throughout the history of the world that there are those moments. And there's the old quote that says, you are called to the destiny you're given, not the one you want. And we as a city, if you look, we were the first in, Brandy. And because of the steps we took, and were very intentional and worked really hard to bring people along, to work across governments, to work with the healthcare industry and private business, today Seattle has the lowest incidence of COVID cases, hospitalizations, and mortality rate. That's a remarkable accomplishment. It doesn't at all undermine the fact that a lot of people have suffered. That is just as true. But as a city, I think we came through that as well as we could because we pulled together and focused on our common interest.
But we still, as a city, have some of the strictest mandates in place in the country and as a state. And I kind of wonder why, I don't know if you saw what Colorado Governor Jared Polis, a Democrat, said. He said that with the availability of the vaccines to adults and children, he considers the medical crisis emergency to be over. He said at this point, if you're unvaccinated, that's your own darn fault if you go to the hospital. Do you agree with that mindset?
No, I think the virus has shown that that's not been true at any stage for people to declare it's over. We just saw this week that Cornell University went from almost 0 cases to 900 cases in a matter of days, and they closed their whole campus. Omicron's real. We don't know how dangerous it is yet, but we do know it is much more transmissible, that if you are vaccinated and not boosted, you may be more susceptible, it may be less severe. And so we are still in the throes of having the last stages of what this virus will do before it gets to the place where it's one of the things we deal with on an annual basis like we do with the flu.
What is that place, though? When is that time? What is the benchmark?
I think the benchmark is, if you look historically, and I'm not a virologist, although I feel like I could play one on TV now, I've spent so much time with them. There is a scientific growth. And over time, one thing people are hoping about Omicron is it is more virulent and maybe less serious. But because it's more virulent, it could eclipse Delta, which has things. And that's what happens in the course of a virus. But we don't know yet because the Southern Hemisphere is still creating so many mutations because there's so few vaccinations there and they're at higher risk. And so we don't know. No one can predict with certainty what will happen with this virus. And I think it's foolish for people to pretend they can.
You and I have talked many times during the pandemic, I think over 50, because for some reason you kept doing interviews with me every week, which I don't know why. We do get along, though. We get along fine.
See, it shows you, though, I thought it was super important during the pandemic because people were sheltered at home to be as transparent as possible and talk as much as you could to members of the media so that people could get information firsthand on an ongoing basis.
I give you credit for that. Because we had some interviews that weren't necessarily pleasant, but we still, do want to get in the following week.
That's part of government's job, in my view, is you have to let people ask the questions because otherwise all you breed is distrust.
One of the questions I asked you towards the beginning of the pandemic was how you strike the right balance between preserving life and protecting liberty. And at the time you thought that balance was being struck and was appropriate. When history looks back at this moment, do you believe you'll have struck the right balance between life and liberty?
Absolutely. And I think that right now we're in a phase 2. It's like you've just indicated, is every step of the way, individual choice has played a role. And people can stand up and do what the science tells them will protect them and their families and their coworkers, or they can't. And I'm really fortunate because I happen to be the mayor of a city where people made the decision to take those steps that they thought would help themselves, their families, and their coworkers.
But sometimes those decisions were, I don't know if I would call them a choice. I mean, they were very difficult for people to make, like facing the loss of their job. And I don't know if I'm faced with the loss of my income for my family, whether I call that a personal choice. For the last, I think it was about a month and a half, I was every week, are you going to fire unvaccinated officers? Are you going to fire unvaccinated officers? And you just wouldn't answer the question directly. And now that we're there, is there a reason? Is there a reason you wouldn't?
Because I think the flip is also true. Are those officers going to get vaccinated? There is free choice and free will. And I think the real story is over 90%, I think we're close to 94, 95% of officers made that decision. And so the real question is, why did they do it and the others didn't? And why are the ones that held out, was that the right choice for them and their families? That's their decision, but clearly would not have been the right choice for their coworkers or the public they serve. And when you're in the position that you're serving the public on the front lines, you do have to make choices that are part of that job.
And there's still, to my understanding, correct me if I'm wrong, the officers who were granted an exemption, their fate, if you will, is still up in the air, right? That has not been finalized?
Correct. They're going through a series of processes depending on what the nature of the exemption is, whether they can be accommodated, and if they can't be accommodated, every single officer given the chance to start the vaccination. because we want people to serve. And so I think that we still don't know the final numbers, but again, I think the really remarkable thing is the majority, the vast majority. And frankly, I think it's too bad that, for example, the head of the police union didn't speak up for them. Because all of these discussions, as you know, in the public realm can either increase or decrease trust in the department as a whole. And I think we really have to do everything we can to support our officers and show that by and large, every single officer shows up every day, working hard, long hours to serve the public.
During the conversation around the mandate, both with the governor and here locally, the rationale that was given to the public was we need to protect children who are not yet eligible for the vaccine. They don't have that choice. So we need to make responsible choices as adults to keep them safe. Well, that's a moot point now, right? Because kids whose parents want them to get the vaccine have had ample opportunity to receive it. So is the mandate still necessary?
So first, it was one of the factors, and it's not moot. There's still many kids who aren't vaccinated.
But they have had ample opportunity.
No, because there's some that weren't eligible under the CDC guidelines. And so, you know, you have the different bands of kids at different times. And so we are working through, but I think it would be a cold calculus to say, you parents who have kids who haven't gotten it yet, too bad. I, as an individual who serves the public, think my right to not be vaccinated is more important than your children. So I just think, and it was only one of the factors. Again, we have first responders, as you know, sometimes are the first to respond to a medical emergency. And that medical emergency, you're in very close contact, sometimes even very, very close contact. And if you have someone unvaccinated who renders that kind of aid, you know, do you want to say the good news is we protected you against the heart attack, but the bad news is your parent now has COVID and is on a respirator?
To watch my full conversation with Seattle Mayor Jenny Durkan, become a subscriber on Patreon or on Locals, patreon.com/undivided or brandycruz.locals.com. This week, a Chehalis bar and restaurant called Mackinaw's and the Curious Bar had its liquor license revoked by the state for failing to follow COVID mandates over the course of about a year and a half. And when I say they got their liquor license revoked, I mean literally agents with the Washington State Alcohol and Cannabis Board removed their liquor license from the wall. As you see, the restaurant had some colorful language on there for Governor Jay Inslee. Apparently, and the restaurant acknowledges this, they did violate the governor's mandates, including allowing indoor dining when indoor dining was banned. They also allowed customers not to wear masks, and a lot of employees weren't wearing masks as well. So I spoke to the owner of the bar and restaurant, a woman named Chef Laurel Kahn, about what happened and about what's next for her. The obvious question that people are going to have is, why would you be willing to risk everything that happened over the COVID mandates? Why not just follow them and keep your liquor license?
I've always been that person that fought the battles. Always saw the bigger picture. At 4, my uncle was shot down in Vietnam. As a young girl, I learned that there's more to this world than my little teeny world there. When the governor did what he did in March, I said, no. Anytime there's fear put in the people, that's not the way government should operate. So I stood by what I believed. It's integrity over money. So be it.
And you said there, you've always been the kind of person to try to focus on the bigger picture. So if you're focusing on the bigger picture, the bigger fight, what is that bigger picture for you?
You know, I feel that I have a voice, and I would like my voice to be out there. I have a kind of a plan on where I'm going forward with this. And I have, as a business person, I understand how we can make changes in our government. So I'm going to be a part of those changes or work toward that.
Can you tell me how?
I'm going to actually run for governor.
You are in 2024?
Yes.
Oh, well, this
So
is
this
this your
is actually my official announcement. I put my first paperwork in, so now I have 2 weeks to get my financial little paperwork done.
You know, there are going to be people, though, who will push back on you. And I'm already seeing it on social media. There are businesses across the state who have, at great personal sacrifice, followed the mandates and been able to survive. And so what do you say to all those businesses who did what was asked of them and who've struggled as a result?
And that is a part of the question. I chose to do something because I had to get strength for the community. And I went and I spent time at businesses, and I was always out there just trying to keep us strong and keeping us the fear at a minimal. And by doing that, was able to have people in who wanted to be here. I wish, and I tried to get other businesses to follow what I was doing. If I would have been mayor, our whole city would have been doing something differently. I did what I did. They did what they did. I support both ways. I think the divide and conquer is tremendously harmful right now. And I mean, it's sorrowful, the people I've lost as friends because of what I stood for. But that's the price you pay. And I'm paying the price. And I have to hold myself accountable for what the choices I made. But I stand by those choices.
Now, as I pointed out on my podcast on Friday when I talked about this story, there are two things that do bother me, and I want to make sure that I'm consistent on these. I don't agree with likening these mandates to the Holocaust or to Nazis. I just think it's lazy and inappropriate. And also, I was really disappointed by how the agents were treated with the Liquor and Cannabis Board. I can't fault anyone for doing their jobs, for feeding their families. And so, even Chef Khan acknowledges, some people who were at the restaurant that day did not treat the agents very well. And so I was disappointed to see that. But when it comes to Chef Laurel Khan, I guess we'll have a new political candidate on our hands very soon. In closing today, I want to take a moment to acknowledge the loss of State Senator Doug Ericksen. While his cause of death is unclear, we know that Senator Ericksen had been battling COVID-19. He leaves behind a wife and 2 daughters and a legacy of staunch conservative values. While his political views were certainly outside the mainstream in Washington state, the senator was grounded in his convictions and frankly a really nice guy to chat politics with. He didn't brush off the hard questions and stood firm in his beliefs. Now, I could use this time to condemn those who are celebrating his passing. I could use this time to talk about how horrible it is to suggest that someone deserves to die because of their opposition to COVID mandates. I could use this time to talk about some of the atrocious headlines surrounding his death. But honestly, I'm not sure that it would do much good. It is a sad testament to where we are as a country when we revel in the death of a fellow human being simply because their political views were different than our own. I hope that we can find a way out of that place because the survival of our country depends on it. Thank you so much for joining us on Undivided. There will be a new podcast out today. And if you haven't become a subscriber already, now is your chance. You can subscribe on Patreon or Locals, patreon.com/undivided or brandycruz.locals.com. Undivided is brought to you by 1530 Mortgage. Visit them at 1530mortgage.com.